Talkopolis, the social media TV network for your city.
Hi guys, Kane Harrison here. Welcome to the Nashville Health and Wellness Program. We are delighted to have Dr. Hamilton on the program today, who is the founder of Icon Pediatrics. Welcome, Doctor.
Thank you.
Now, something that is incredibly special about your pediatric practice is that you do concierge. Explain that a little bit first and foremost.
Well, concierge medicine is a different way of delivering care to families. Instead of using the traditional reimbursement model of third-party insurances, we are more of a retainer-based practice where people will pay an annual or monthly membership, and they'll belong to the practice as a member, and in return they get a variety of services.
Now, I think that concierge isn't a new thing, but I think most people are aware of that in the adult medical industry. Talk about you coming up with, I guess, the idea of the pediatric practice and then combining those two things.
Right. And as you mentioned, concierge is not new. It's been happening for quite a while in the adult world, and people who take care of adult patients. But it's starting to happen more and more in the pediatric world as well. Not so much here in Middle Tennessee, but in other parts of the country, there are a number of practices who are doing it already. But I think the trend is moving in that direction. And a number of factors are driving that. For me, it was a matter of wanting to kind of go back to the way I used to care for patients, where it was more of a direct one-on-one relationship with the family. Having previously owned and operated a very large multi-site, multi-specialty practice, I realized that it becomes somewhat impersonal after a while when you're focused on seeing a high volume of patients and the overhead that's associated with that. So in this model, I'm able to now go back to where I take care of a smaller number of families, have a more personal, intimate relationship with the families, and actually, in my mind, provide a higher quality of care to each individual child.
And I mean, an element of consistency, which we'll go into later on, because they always will be talking to you. But just explain to the people at home some of the major differences between the adult concierge programs that they may have recognized in the past and now pediatric.
Right. In most adult concierge practices, you'll find that they're caring for mostly seniors. Certainly there are some models where the demographic is a little bit younger, but many of these practices are caring for people that are now on Medicare or Medicare eligible. They often have a number of medical conditions that are chronic. They're on a number of medications, and so their needs are pretty intense in those settings. Also, you'll find that in some concierge practices, they're coming up with kind of non-traditional services that they're providing, such as anti-aging therapy, personal training, executive well visits, that sort of thing. So I think people are defining concierge kind of as we go. Healthcare is not being reformed just in terms of the government's role and the third-party insurance role, but just in the way we deliver care. That's just changing around us right now. So my approach on the pediatric side is, what do families need? What are families looking for in their relationship from their doctor? And I think that we're used to the idea of going to the office and waiting for a good while. A doctor's seeing 5 or 6 patients in an hour, spending 5 to 7 minutes with each child in terms of face-to-face time. In the concierge model, we're not hurried, we're not rushed, we're not trying to see a high volume each day, and our visits are not timed. We're not under the pressure to see several in an hour. We don't have people waiting to be seen. We have one office, one exam room, and people are seeing one patient at a time. And so when the child is there, they have 100% of our attention, and our sole focus is on that individual child at that visit.
Now, I mean, when we first met in your office, it's a fantastic facility and plenty of room for the kids to play around, toys and such. But you explained to me concierge and actually what that meant. And someone for myself, I'm 36 years old. I don't have children. My parents are obviously in Australia, so I'm not looking after grandparents or anything like that. So I would probably be moving into the bracket where I would potentially be a client of yours. So there's a vast number of people out there who probably don't know what a concierge service actually is or offers. Can you just go into that a little bit?
Sure, and it depends on the age of the child. So, you know, when you have your first child and you don't know much about caring for babies, and you don't know what to expect and what's normal, what's not normal. You need a lot of support. You need a lot of help. You need to be able to call someone with just simple questions and get an answer and not feel like you've bothered someone. So that's what concierge offers for that new family who doesn't really know what they're doing. You've got someone who's going to be patient and understanding and know that even though I've heard this 1,000 times before, it's your first time experiencing this, and so I'm able to walk you through that colic or that first fever or what have you
Sure.
in a way that I'm not able to do when I have a much larger volume of patients to care for. And then as the child grows, the relationship grows with the child. So if you know me as an infant and toddler and then a preschool age child, then by the time your child's in high school, you're going to have that long-term relationship with me that is so important. And so now I'm able to not just have that once a year physical for a 13-year-old, but I may see you 4 or 5 times in that year. Because one visit we may focus on the musculoskeletal exam or the cardiac exam. Another visit we may be focusing on at-risk behaviors. The child that's now being exposed to substance use, peer pressure, bullying, things like that. We can now talk about those things with someone who has a long-term relationship with you, and your child's going to be able to open up more. We'll talk about school-related issues in depth in a way we can't do in the traditional practice. And we also can focus on mental health issues, which are often neglected in our society
Absolutely.
now. We have teenagers that are having anxiety or depression, and it's not really known until something bad happens. And so in this model, we're able to probe a bit more and make the family and the child more comfortable where they can share those thoughts and concerns with us in a way that's well beyond just taking care of strep throat and giving vaccinations.
I also think the model's fantastic, even from a financial planning type model. I mean, because children can be so expensive, we never know when they're going to be sick.
That's
We
right.
never know, how much we're going to have to shell out in any of those conditions. So the idea that it's a monthly fee that people can pay and know that they can pick the phone up and call you or any of your wonderful staff at any time is so reassuring for especially a first parent, I think, more than anything.
Oh, absolutely. And I think that's part of what we call the value proposition. Not only are we going to provide you a higher level of service and higher quality, but we're going to do it in a more economical way.
Yeah.
We're convinced that we can demonstrate that your out-of-pocket costs will be less in the concierge model than what you're currently paying now in an environment where you have high deductibles and co-insurances and co-pays. The other thing is that there are intangibles people don't think about. So for example, if someone calls me right now and the child has a rash, my motivation in the traditional practice is I got to make sure that I see you in the office face to face because I can't bill for that service unless I see you. But in this model, the concierge model, if you have something that doesn't really require an office visit, we can handle that electronically. You may take a picture and send it to me and I can diagnose and treat over the phone or by texting or emailing or Skype or FaceTime. And what you realize is not only have you saved money by not having to come in and pay a copay, but you've also not had to take your child out of school.
Yeah.
You've not had to take off time from work and use your PTO,
Yeah.
for an office visit that really you didn't need to be seen face to face. It could have been handled remotely. And so the concierge model has an incentive in managing things much more efficiently than the traditional model where it's so driven by how many patients did I see that day.
I think it's fantastic. I know we spoke in your office at length about different scenarios, and one being we were just headed to Destin, and you were like, you're on a family holiday and something happens and you can just take a photo or whatever you need to.
That's right.
Rather than heading down to the emergency room and shelling out $50 or $100 or whatever it might be. So
That's exactly right.
the concierge model is fantastic. Dr. Hamilton, we've enjoyed having you in today, and of course you're going to stick around. We're going to do another segment because we can get a lot more in depth on what is offered through the Icon Concierge service. Dr. Hamilton from Icon Pediatrics will be back after this.